Queen Brenda here. Yeast is naturally present in our bodies, but compromised immune systems may fail to regulate the growth, resulting in yeast infections. What this means for the hospice patient who likely has a weakened immune system is that they can develop yeast infections on their skin. Yeast likes to grow where it's dark and it's moist, so they usually show up in the body, under the skin, in the folds, under the arms, under the breast, the folds of the belly, the groin, in the periarea. Signs and symptoms of yeast infection are red, irritated rash, often with well-defined edges, and they are itching and burning, and they can be intense and uncomfortable and painful. Skin breakdowns showing up as raw, sore, or cracked skin in the affected areas. A real giveaway that yeast is present are little satellite lesions that are small red bumps or pustules surrounding the main rash. There can be oozing or scaling. In some cases, the skin may even crack, peel, or secrete a clear fluid. And finally, yeast has an odor. It has a foul or musty odor, or it can be mild and yeasty like bread due to the overgrowth of candida. Treatment is pretty straightforward. First is it's important to keep the area clean and dry, which can be challenging. I encourage my patients to get some air to the area after gentle cleaning. Blow dryer on a low setting and kind of far away enough so that it doesn't get too warm is a great way to really get the skin nice and dry before treating it. I also suggest a small soft towel rolled up and propped under the skin fold or in, so that it can get some air to it, but only if they can tolerate it. And if a patient's wearing a brief, I try to leave it open while they're still and resting. An antifungal medication is what treats it, and it can be both over-the-counter or prescription. Hospice often provides nystatin in the form of powder or cream, and applying it 2 or 3 times a day usually does the trick. It takes 3 to 4 days to see the rash start to improve and 7 to 14 days to clear. Consistent use is the key to clearing it. If a topical antifungal hasn't worked to clear the yeast infection, the next step would be an oral prescription that works systemically. If this fails, it could be that there's a secondary bacterial infection that may need to be treated with an antibiotic. I hope that helps. Click the link below to get a copy of our booklet, The Hospice Care Plan, A Path to Comfort. This booklet is helping families and caregivers at the bedside quickly and effectively and safely care for the hospice patient.